Nutrition Hero Podcast. Igniting both the art and the science of functional medicine. Here's your host, Dr. Brad Watts.
Hello, Nutrition Hero family. This is Dr. Watts with Nutrition Hero, back at you once again, sitting in the podcast lab as per usual. Thank you for participating in the podcast. I'm excited to be here. I'm excited to be bringing you guys content over the last couple of years that highlights experts in the industry. It highlights, well, specifically new areas of application in nutrition and functional medicine. It's been pretty fun. And one of the things that I've always wanted to do is I've wanted to highlight actual nutrition heroes that are treating patients in their community, so you don't just get my take on things all the time. Right? I'm a practical guy. I'm a simple guy. Right? We talk about what works, what doesn't. Well, I'm excited today to bring you some snippets of a conversation I had with a doctor. His name is Dr. Jared Roscoe, and he's in Clearwater, Florida. He's serving his community in a great fashion, and you'll hear more about that today. One of the companies that I consult to is called Biogenetics, and Dr. Roscoe is the national leader in usage of a specific step with biogenetics and an application. And so I wanted to bring some content from him today to you so you can see how you start with most new patients in a functional medicine setting, and what that looks like as far as community impact, what that looks like as far as the passion from somebody just laying it down every day, serving their community in a way that not a lot of other people are. And isn't that what Nutrition Hero podcast is all about? I say it is. So, without any further ado, thank you for listening to today's podcast. Here is Dr. Jared Roscoe. Dr. Jared Roscoe, welcome to the Nutrition Hero podcast. Thank you for joining me today, sir.
It's my pleasure, Brad. Thank you so much for having me.
Absolutely. I'm glad to get to talk with you here. I've known you for a few years and cordially like seeing you at seminars and stuff like that. But I'm excited to unpack a few things that you're doing as a mover and shaker in your area. And so this will be good. So anyway, I would like to start here today if we could. I'd like to start with your history. How in the world, I ask this to everybody by the way, how in the world did you get involved in functional medicine? What are you doing here?
What a great question. You know, it's funny, Brad, because we have known each other for what, 5-6 years now, I think, but we've never had this conversation. So what an interesting place to start. And it's even funny because I come from a allopathic family. Every other person in my family is a medical doctor, and they're completely traditional. They're surgeons, they're family medicine, you know, the usual blood pressure, medications, you know, cholesterol meds, the whole thing. So it's kind of an interesting thing that my path kind of led here. So, you know, I think for starters, my interest in natural medicine kind of started at a very young age. And as I said, my dad was a surgeon, and so he would actually take me to the hospital with him, I think twice a week, 3 times, I mean, all the time. You know, that was his thing. He was trying to give me the bug for surgery, the power, the prestige, and
yeah,
you know what I'm saying. Right?
What kind of surgeon?
Ear, nose, and throat.
Okay, gotcha.
Ear, nose, and throat. And, you know, the truth of the matter is, and I don't know if I've ever told him this before, so he's probably going to hear this and laugh, but I think it actually did the exact opposite. I think it, you know, I remember going in there, and I don't know if you've been in a surgical suite before, but when you go in there and you smell the bone, you know, he had a bone saw or, you know, some kind of drill that would, you know, kind of take out the mastoid process on the patient right behind the ear. You smell it, you see the patient's terrified ahead of time, and I just, you know, instead of giving me the bug for surgery, it made me go, okay, that's it. I want to be kind of doctor that knows how to keep the patient out of this environment, you know, and it kind of had the reverse effect that I think he wanted. But that's how I started. I went, okay, that's it, man. There's got to be some way. It can't be this, you know. And I'm talking about when I was 7 years old, 8 years old. You know, and I thought, it can't be this. You can't get sick, have to come to a hospital, get put to sleep, get your body chopped up, and then go through weeks of recovery. And I said, no, I don't. I refuse. Even as a kid, I was like, I refuse to believe that. And that kind of sparked the flame, so to speak.
Gotcha.
And then actually, as an athlete, I branched out into chiropractic and had a great chiropractor through my early teens. And I was quite good as an athlete. You know, I won state competitions and stuff like that in track. So I needed somebody really good, and got in a car accident, had some bad herniated discs in my spine. And that guy kind of brought me back after that. So I was really a true believer in chiropractic,
Sure.
From early teens to late teens. And then kind of, you know, the pressure started coming. Okay, you're getting older. It's time for medical school. And I thought, you know, I think I'm going to pass. I think I'm going to pass. I looked at dentistry. I looked at, you know, being a physician and all that kind of stuff. And I went, you know, I remember the conversation, Mom, Dad, I'm going to be a holistic doctor.
Right.
You can imagine, you know, the black sheep in the family, but
Sure.
yeah, it just took, I mean, you know how with the experiences, it's a great experience to become a doctor of chiropractic. And from there, you know, I just got exposed more and more through muscle testing and applied kinesiology, and then eventual, you know, actual functional medicine with lab work and this kind of stuff. And once you get a taste for this stuff and the kind of results you can get, I think most people never look back. You know, you find your calling real soon with this.
Well, I 100% agree with that. You have a unique impact on your community when you start looking at things through an FM lens. Speaking of which, you right now, you're serving your community, and we're talking briefly off of the recording here before we started, where you're supporting children all the way up through, you know, end stages of health and life, and it's a pretty broad spectrum. What are some of your favorite things to work with? What are some of your favorite types of patients?
So, you know, here's what I would say, man. We treat everything. I mean, you know, just last week I had a 3-day-old come in, and
Wow.
yeah, and you know what? I mean, chiropractic's for everybody. You know, we all have spines. We all need it. So, you know, we'll do the chiropractic thing. I'm a big believer in chiropractic, but of course we do natural holistic medicine, more specifically functional medicine, and you know, my personal things. I mean, I like the whole spectrum. You know, I have a lot of training in a special form of oxygen therapy, which is really phenomenal for cancer patients. So I love it when somebody comes in here and they said, you know, I've been through the ringer, I've done the chemo, I've done this, I've done that. And, you know, not that I quote unquote treat cancer. No, we don't treat disease here, nothing like that. But in the realm of practicing nutritional therapy for the patient, it's quite amazing whenever you, you know, are able to help these patients that do have sometimes even terminal illness. But absolutely, I love working with cancer patients and doing nutritional work with them. I love babies and children because they respond so amazingly fast. This one kid out of the hospital, they had what's called tetralogy of Fallot. I don't know if you are familiar with this. It's basically a congenital issue with the heart where the major vessels of the heart are malformed kind of at birth, and they're displaced. And so it's a surgical thing. You have to have surgery for it. But the kid couldn't get out of the hospital, and without getting too in depth, you know, just doing what we do here, I was able to make a little house call to the hospital for the kid, and we just did a few basic things, and they went home the next day. So love helping children, you know, love helping kids.
Absolutely.
And,
wow.
Right. And the other just total blast for me is I see so much, and this is more I think what we're going to get into today, but I see so much chronic degenerative disease. You know, I mean, you look out your window, I mean, that's what you're looking at. When people walking down the sidewalk is this kind of American, or really it's the world now.
Right.
But you so much chronic degenerative disease, and we can break that down, why that happens, you know, and why I use what I use to kind of fix it. But the one thing that walks in my door more than anything is either diagnosed or undiagnosed Lyme. I see so many Lyme issues.
Really?
So another thing, I just absolutely love helping these people, because I can't tell you how many times, Brad, they come in and they sit in my office in a consult and they say, Doc, I don't think anybody can help me. I've been to every Lyme specialist. I've been to every physician. I've done, you know, Johns Hopkins. I went to Mayo Clinic, and, you know, I've spent $100,000 on this. That's what I hear. It's like a number. I've spent $100,000 on this. And using the simple principles of functional medicine, having some keen insight into how the body really works, you know, I mean, I'm just going to tell you, we're able to change things for these people. So, I mean, that's always a thrill for me.
So let's talk about that a little bit with the Lyme situation. When a patient goes the traditional medical route, Johns Hopkins, Mayo Clinic, etc., what is the strategy that these physicians are using in order to help these patients versus your strategy? What does that look like?
Yeah, what a good question. So Brad, and again, quickly on my background. So I'm a doctor of chiropractic medicine, a couple thousand hours of functional medicine, nutrition, functional neurology, functional autoimmune training, this kind of stuff. I mean, not very hard from you at all. So that's kind of where I'm coming from. I did start medical school. I'm in my 4th and final year of a medical doctorate, okay, an MD degree. So, have I graduated yet? No, but I'm on my way here. I've got some hospital rounds, and I'm actually at that point be able to say I've completed the medical side of things and the holistic side of things. So right. I know both sides of the coin is basically what I'm saying here. And not that I'm telling you I'm a pathologist or an infectious disease expert. I'm not that, but my experience is really all I'm sharing with you here.
Right.
And what I'll add is that, the traditional point of view, you're going to get worked up by an antibody test, right? Something called the Western blot. Mm-hmm. If that comes back positive, which by the way is kind of the laughing stock of the Lyme community, right? Thinking about Lyme, right. It's very reliable, right? As far as the sensitivity, as far as the specificity, it's not a great test. I can't tell you how many Lyme patients come in with a negative Western blot and think they don't have Lyme, and it's not correct. It's not accurate. So that's the first thing. They're going to get worked up with that kind of an antibody test. From that they'll graduate to what's called an ELISA, which is just a little bit more of a sophisticated antibody type exam. So that's kind of the diagnostic process. Okay, it misses. Oh God, I don't know the exact number, but it's something egregious. It's something like 70 or 80% are going to slip through the cracks.
Oh my goodness! Alone. Yes,
it's terrible. It's really terrible. But at that point, and again, here's the honest truth. We do. There's $2,000 Lyme exams. There's $400. I think the most reliable I've seen is what's called a PCR, where you look for actual Borrelia, which is of course the name of the causative agent, bacterial agent that causes Lyme. You can actually catch that Borrelia DNA in the human bloodstream, but it's not foolproof. But anyhow, that's you're not going to see that if you go to some kind of a medical specialist,
right?
But more than that, let's just jump ahead and say you do get diagnosed. Let's say you're one of the fortunate ones where the MD does catch it, because the real problem here is it's not being caught. And more than that, Brad, in medical school, you're taught certain things. It's not the way you and I were taught in functional medicine to think for ourselves, to be the detective, to find out.
Right.
It's protocol. You don't dare deviate from that protocol, or you're going to lose your seat in residency. You're going to lose your seat in that clinical rotation. You're going to be ridiculed. You're going to be the guy that got dishonorably discharged from medical school, so to speak. Mm-hmm. So, and when you're $200,000 of debt in there, and your whole family and friends are counting on you, it's like no, it's just until you're in that environment, you don't understand it. But once you're in that environment, you get it, how this happens and how these guys get out of school thinking that they know the whole entire picture and that their word is gospel. That this is it. Here's how you test for it. You have it. You don't have it. Their word is the word of God. And that's it, man. And that's kind of what I see in my practices. They say, I've been to these places, and the ones that are lucky enough, Brad, they get 18 months of antibiotics, which destroy the gut microbiome, which we know how critical that is for brain function, for human health, for proper bowel function, and just about anything under the sun. And not to mention antibiotics, things like doxycycline, right, which can be life-saving. Don't get me wrong, I'm not an anti-medical guy. I'm just saying there's a big difference between life-saving emergency medicine and the management of chronic disease with synthetic pharmaceutical drugs. Bingo. Which, of course, we know things, they're poisons. By definition, they're poisons to the human body, and they corrupt mitochondrial function. You're going to destroy the patient's mitochondrial function here if you do these long-term antibiotics. I see the worst side effect is. But that's what you can get mainstream.
So when you take that mainstream approach, somebody's been put through the ringer, and the success rate, obviously, we're not going to put a number to it, but if they're showing up in your office, something's not happening the right way, okay? And understanding that tools with a functional medicine perspective, let's talk about that a little bit. What are some of your approaches, just to highlight the testing, which you already did, PCR, etc., but moving into resolution, what does that look like when you're supporting a patient's ability to heal?
Right. Yeah. So, again, the medical model is looking at this, Brad, and saying, okay, the problem is there's Borrelia, right? There's a bad bacteria that's in the body. It's hurting the body. We're going to give these drugs, which have their very specific mechanism of shutting down DNA synthesis or cell wall synthesis or protein synthesis at the ribosome, right? That's how these drugs work. They each have their own specific mechanism of action. But the point is, we're going to use antibiotics that are synthetic and man-made to kill the bug. Health is restored, right? That's the traditional allopathic viewpoint, and that's the fallacy. It's fake. That's not actually the way the body works. That's not actually the problem. It's not actually the problem. So these patients come in, they sit in front of you, you hear the sob story, you hear the horror story they've been through, and rightfully so. They have been through hell, and they've been mismanaged. And and it's not just the traditional guys. You look at holistic guys, or quote unquote holistic guys. I'm talking more about MDs, and there's some amazing ones, and there's some other ones that charge an arm and a leg, 10, 20, 30, 40, tons and tons of thousands of dollars to flood your system with intravenous vitamins, which is good. I love IV drips, but I'm just saying, getting to your question, without that proper understanding and that proper kind of assessment as far as what's the real issues with the body, you can throw all the IV drips you want at it. It's green medicine. That's just natural take on the wrong paradigm, right?
Right. So to summarize that real quick for people that are listening, what you're saying is practicing medicine with not as strong of an intervention, right? Green medicine, talking about it in those terms. So something that's, nutrition, but from an allopathic model.
Correct. Like the classic example is red yeast rice for lowering cholesterol.
Right.
Instead of saying, why does this guy have high cholesterol? We just say, we're going to lower the cholesterol, but use a nutrient instead of a drug, green medicine.
Right. You get that all the time, by the way, too, with patients that have high blood sugar. And it's like, well, I don't want to take metformin, so I'm going to use something else that hammers down my blood sugar. Well,
right.
Like, you might as well stay on metformin. It's going to be 10 times cheaper if you're going to use that model. Right? Like, exactly. That's understandable for sure. So.
Oh, totally. Interesting drug, by the way, metformin. It stops gluconeogenesis in the liver. But yeah, poisonous drug, same thing. I mean, that's the point. Is you look at the therapeutic index of these drugs, and basically, you weigh the cost versus the benefit, the perceived benefit, and we call that the therapeutic index. And you're shocked when you actually look at what these drugs do to the body. But anyway, I digress. So, but the point is with this, Dr. Brad. So, and stop me if I'm going too in depth here on this question, but
no, go ahead.
What's really missing in traditional medicine? What's really missing in even green medicine? And what changes when they come here for a workup by somebody like you or maybe somebody like me? And, I like to think of it in terms of this, is we ask the question, why? Okay, we want to understand, why did this happen? And a little funny story that just popped into my head is whenever, you and I, we've sent emails back and forth and stuff and kind of talked about different patients and interpreting different labs and these kinds of things. And I remember one time we had this patient that was a real mess, and we maybe went 6 or 7 emails back and forth, and you wrote me back one day and you just simply said, what do you think happened to this patient to send him on this wild, this kind of crazy, unfortunate decline in their health, and I kind of laughed to myself and went, what a brilliant question, because you have our best and brightest, so to speak, at Duke, Johns Hopkins, right? These PhDs, these MD PhDs that are brilliant, but no one's asking the question why for the most part,
Yeah.
And I think that's really what you need to understand. I think that's what we do in functional medicine, is we say, all right, what actually did go wrong with this person? And of course we personalize it. Of course we make a specialized program for them. But I'm going to be honest with you, what I see is we're all really suffering from the same stuff. And if I may, Brett, we're all exposed to life in the 21st century here, which is flooded with EMFs. It's flooded with chemicals. It's flooded with genetically modified organisms that, people are eating stuff that's not even food. I mean,
right.
There's a big differentiation between food and stuff people eat, right? You can eat cardboard. It's not food.
That's right.
Right?
That's right.
So you look at what a lot of these people are eating. It's like, okay, is a McDonald's burger edible? Well, okay, maybe. Is it food? No, it's most certainly not food, So you put this perfect storm, if you will, this milieu of the dietary issues, the chemicals, the psychotropic medications, the antibiotics, all this stuff that's getting into your body, whether you want it to or not, because your animal was pumped with, the animal, our livestock was, fed this stuff, and our water supply gets, saturated with this stuff, et cetera, et cetera, et cetera. You get dysfunction of the human body, and it manifests differently on different people. Okay, some express it as chronic fatigue and Lyme, some express it as Alzheimer's, and are there exact mechanisms that are slightly different? Well, yeah, 100%, and that's the nuance of what we do. But to finally get to the point of what I'm trying to say here, the difference is, Brett, we work them up and see what's happening with the function of the body. What's the gut health doing? What's the strength of your immune system? Tell me about your essential amino acids. Let's look at this on lab, because guess what? The problem's not Lyme. It's not Borrelia. Borrelia exists. All the various co-infections. There's over 130 species of Borrelia. Not the problem. You're going to encounter this stuff. You've encountered it, Brad. I've encountered it. We all have. Same thing as Epstein-Barr. Same thing as COVID-19. You're going to come in contact with this stuff because you're on planet Earth. That's what happens.
That's right.
That's not the variable. The variable is the terrain. How strong and healthy is your body? Because you've seen all this stuff, and guess what? Your white blood cells probably have killed it. Your innate and your adaptive immune systems have probably killed it. When that doesn't happen, what's the real problem there? Is it the bug, or is it the person's body? Do we need to kind of build up the person's body and maybe simultaneously kill the bug with natural herbs? Or do we do the traditional route and just kind of kill the bug and have so-so results?
That's right. So one of the things, I like to speak in word pictures to my patients. They understand the pictures really well. And one of the things to illustrate that in context of what you're talking about here is, like, I wouldn't send my 5-year-old out onto a football field with the Dallas Cowboys, right? I wouldn't do that. That's not going to end well. Ultimately, right, you have two choices. Either you build up the kid so that he can go out onto the football field with Dallas Cowboys, or you limit the exposure to the Dallas Cowboys, right? Those are your two choices. And in functional medicine, when we're talking about terrain and building patients up, etc., when we talk about those things, we want to make sure that we're working from both ends of the spectrum. Like, you're not going to go suck the carbon monoxide out of the tailpipe of your truck, right? You wouldn't do that. But also, you got to understand that your body has to have the ability to detox appropriately, right? Like limiting exposure on one end and handling the result of exposure on the other. When we look at what's going on with Lyme or diabetes or anything like that, there's that bookending, that balance. And so that's what you're describing. I think that's phenomenal.
Oh, well, thank you, Brad. Thank you. I mean, it's just what I see. I mean, working with the body day in and day out. And I think, same thing. You're on the front lines like me. You're seeing these people day in and day out. And I think, how many does it take? 10, 100, 1,000? How many years of your life you put into this before you go, whoa, I get it. This is what's actually going on with these people. The medical community has it wrong with a symptom-based drug management model. The way we need to work this up is, how do we rebuild this terrain? How do we kind of clean out the body, detoxify the body? How do we repair the gut? How do we protect the body from all the various stressors that exist in the 21st century that the human body was never meant to see? And I think whenever you kind of crack the code for that, you see these diseases vanish. They go by the board, so to speak.
Well, exactly. One of the things that you just mentioned here is really prepping the body with detoxification or re-inoculating the gut or fixing the terrain situation. What are some of the steps forward that you find commonly with patients that have chronic disease?
Ask me that last part again, Brett. I didn't get the last two words.
What are some of the steps that you use to move forward with patients that have chronic disease? Whether it be testing, implementation, intervention, what does that look like for you? Absolutely.
So, look, I'm a big proponent of doing things this way because, again, just like you, I mean, you see enough patients, you learn what works and what doesn't. And in a functional medicine model, there's not a lot of room for error. It's not like you can have someone come in here, do a big program with you and not have gains, that they're not going to come back. It's kind of a very different thing than an insurance model where you get unlimited attempts. So the point is, if you're going to do that, and I think you'll agree with me here, if you're going to do this kind of practicing, you get good fast, and you have to kind of keep the practice alive. So what I've seen work, Brad, I'm a big fan of this. I like to start broad. I like to start very wide scope with people. It's like, as I said before, of course we personalize, of course we find the mechanism, but as I said, I do think there's common ground on every case. Everybody's going to need to detoxify themselves kind of day one. We're going to need to open up phase 1, 2, and 3 detox pathways in the liver. We're going to need to clean out, intracellular spaces, on these patients, right? There's common ground there, right? I mean, we're going to need kind of from there to graduate to heal the gut, right? And of course we tailor make this, but, as a general, method here, I'm a big fan of, quote unquote, detoxifying the body, let's say, and that's what I do for the first month. I do work the patient up with muscle testing. I do work them up with lab testing simultaneously. Usually we'll do stool testing. We'll do kind of a nutrient panel. Of course, I do the prudent medical panel to look for all the various things that we look for in functional medicine, from Hashimoto's to blood sugar mechanisms to, different anemic tendencies, et cetera, liver function panels, all the stuff that we need to look for. I'm a big fan of stool testing as well, although I'll tell you, arguably the number one thing, even more than Lyme, that I see in my practice is, if I say metazoan or helminth infections, Brad, you familiar with what I'm talking about?
Yep.
Yeah,
Yep.
worms. Talk about worms. Intestinal worms, whether it's like a cestode or a nematode or, a fluke, right? We see worms. My God, is it prevalent? And creepier than that, you see these things come out, right? That's I could show you the pictures I have of all these tapeworms and gut infections, these different parasites that come out. It's hard to believe until you see it. But the point is,
it's we call it the zoo. I mean, the zoo is real.
The zoo is real. The funny part is when they come in, they go, "Well, my GI doctor said I didn't have parasites," and I said, I'm like, "Well, your GI doctor was sitting across from you with parasites swimming in his gut, telling you parasites swimming in your gut." You guys both do.
That's
and I tell them, the test for parasites is quite easy. You can do it right now at home. You put your fingers right by your where your pulse is, and if you feel a little pulse in your fingers there, that's positive. That's positive for parasites.
Oh goodness.
But the point is, you detoxify pretty much everybody. You need to heal and clean out the gut on just about everybody. And then by the time we get to, kind of phase 3, as I call it, I can really start to kind of narrow it in and kind of laser point, say, okay, we know we can check it off the list. We've detoxified you. We know we can check it off the list. We've cleaned out your gut. We've healed your gut. We've definitely put the good bugs back in there. All right, let's get real specific and give you a very tailor-made program at this point. And the way I see it, I like to optimize cell function, optimize mitochondrial function, and that's the cherry on the cake. That's the the icing on the cake, so to speak.
Right.
It's the cherry on top.
Right. That's cool. I think the one of the things that you find in the marketplace today are patients that really get into detoxification on their own, and it's a buzzword, right? Detox, detox, detox.
Right.
And anywhere from detox tea to like, make this special concoction that tastes like fire and and detox your liver scenario. When you talk about detoxification, what does that look like typically, and how long do you typically plan on detoxing? I mean, I don't like that word, but detoxing, you know what I mean? A patient. What does that look like for you? That's a broad stroke, right? But it's a necessary step. So what's that look like?
It is, and it's a junky fast food functional medicine term. I don't like to say detox.
Right.
I say it because the patient understands that word.
Right.
But look, I'm a huge fan of the biogenetics line. I think as far as quality and as far as clinical efficacy, honestly, you don't need to use these products for very long before you go, whoa, there's something different here. Okay. So one of their best products, and I think I'm actually one of the, if not number one in the country for using this product. I'm a huge advocate of this product, is their 21-day metabolic clearing kit, which I know you're familiar with, Brad.
Yep.
And look, I look every day. I have patients come in here. Oh no, I did a detox. Okay, what'd you do? And it's what you just said. I did some tea. I did some herbal tea. Okay, all right. Or no, I did cayenne pepper and maple syrup and this kind of thing for 3 days. Or okay, all right, good. So what we're gonna do,
right.
We're gonna use very targeted nutrition here to activate certain aspects of your DNA, right? Your sirtuins, these kinds of things that are gonna kind of stimulate your endogenous production and your endogenous recycling of glutathione, these kinds of things, to really truly get your metabolism happening the way it needs to. I know you and I have talked at length about mitochondrial function, and as far as I know I think this is your patented term, the metabolic dust and whatnot that happens, poor mitochondrial function.
Yeah.
So I explained to the patient, look, we're going to use something called a nano liposome, which is kind of number one in the field. I take it over intravenous strips, okay, as far as its ability to get to the intracellular space where it's needed. And, the nutrition tightly packed within that nano liposome, which is, of course, part of the 21-day clearing kit. I'm telling you, I've seen these Lyme patients that have done the ozone, which I love, but they've done the ozone, they've done the drips, they're still sick. We use the nano liposomal formulations with, of course, the various antioxidant formulations that BioG offers, biogenetics. And I'm telling you, it's not a cure-all, but my God, does it really get the ball rolling in the right direction? So, use the term you want to use to describe it, but what it really is the way to open the case. It's the way to get the guy in the door, the way to really get things shifting in the right direction, talking to his DNA, talking to his mitochondria, which don't forget has its own DNA, and starting to actually clean out, and this is the detox factor that I think is starting to actually clean out debris. Don't forget Borrelia is an intracellular organism. Don't forget Lyme toxins. Borrelia toxin is intracellular. That's where it does its damage. So, we want as much nanoliposomal reduced glutathione inside that cell as we can get, because I guarantee they're deficient.
Very cool. I think that step of just pushing, like one of the things I talk about quite often is there's no healing in nutrition. There's no healing in pharmaceutical situation. The healing is in your body, and it's your job to work with it, to cultivate it. And a detox, right, or a broad spectrum approach at supporting the multi-function of your gut, your liver, your kidneys, your skin, your mitochondria, the ecology in your gut, as I mentioned. That's a necessary step to get that power that heals the edges of a cut together, to get that to come out of the basement. So it's necessary.
I couldn't agree more.
It's necessary.
I couldn't agree more, Brad.
What do you think is, where do you see the future of chronic disease care in the United States? Do you think medicine's going to adopt this personalized scenario like you're talking about here? Or do you think it's going to be, the cream rises to the top? The population gets crappy care, and when it comes to chronic disease, and functional medicine for the rest of us. What does that look like in your eyes?
Yeah, that's a powerful question. Brad, honestly, I think it's up to guys like you and me. I mean, I think left to its own devices, is the medical community going to wake up one morning and say, oh man, let's start doing, the 21-day metabolic clearing kit, or let's learn about nanoliposomal glutathione or nanoliposomal resveratrol. I don't see that happening anytime soon. So I think it's up to guys like you and me. If that happens, it's going to be because people like us work hard enough, and we set up the different clinics that we need to set up, and we speak out like we're doing right this very second, and we make our voices loud enough where it becomes undeniable. Where you see clinical results, and we do need people that get into the field of medicine. I mean, that's why I went back to medical school, and it wasn't fun doing 4 or 5 more years of doctoral training, especially with the paradigm that I didn't agree with.
Right.
What you and I talked about this too. I think you need to go too, but that's a different topic entirely. But, but the point being, you're brilliant, and it's not from that point of view. It's from the point of view of just simply, we need people within that system to change that system. That's more what I'm saying.
Oh, well, yeah, so, I understand. I got you for sure.
Yeah, so that's more what I'm saying. I mean, I think we need these kinds of docs like you and I, lots of other good ones that we know of. Really taking it, to the max, and kind of making it our own responsibility to change it, because we both know the future of medicine should be what we're doing. Am I right? I mean,
that's right. One of the things to note, I'm assuming you'll have patients listening to this podcast and that type of thing. One of the things to note is that transition for mainstream modern medicine to participate in the style of care that you do and I do, I think that's going to take decades, if it happens at all. And the reason is that people have fallen in love with pathology to such an extent that it's pathology focused. It's not healing focused. And, as I sit here and we're talking, and I get your passion for helping people, and your ability to work through physiology and biochemistry, dip in and out, just even in the language of it, is pretty strong. I mean, not a lot of people that can speak to the things you're speaking to like this today. But one of the things that I appreciate, and I know this for a fact in your practice, is that the patient responsibility is high. It's high because it's the only way that functional medicine is going to have any legs moving forward, is inspiring patients to take responsibility for their outcome. And I think that's a really powerful thing as well. So I just want to say that, as again, I'm sure you'll have patients that are listening to this as well. And it takes integrity as a provider in order for you to lay it out there and say, here's the plan moving forward, but you got to do it to the patient, rather than a passive drug scenario that tries to overcome the patient's lifestyle. And I think that's important. So,
wow, how perfectly said. It's so true. I mean, the only cases that fail here are the ones that throw in the towel. You know, they say,
right.
nah, I want to eat white rice. I want to drink my Pepsi Cola or whatever it is, and I don't feel like taking capsules or taking this powder or whatever. And it's like, oh, it's your body. You got to live in that body, so it's up to you. If you want it to keep declining, I can't make you do it.
That's right. So
Right.
when
So
you
true.
look at patient responsibility and motivating patients to do what's best for their own health, how do you view that? Like, do you have any specific coaching strategies that you use with patients, or is it, is it inherent? Like, you only serve patients that know they need to do something? Like, is there a process where you help people get motivated?
Right. Yeah. You know, I'm not selective about who I'll treat. You know, I have, it's what you said, you really, and I think maybe it's true for everybody, but I think for the majority of us, that kind of made this choice to go into functional medicine, we do care about people. And when the person comes in and you see in their eyes, they're not lying to you, they're not faking, like they're at their wits' end. They've literally been everywhere. And, and not to be so dramatic, but I do get people that they're like, we're worried my mother or my dad or my wife or so-and-so, they're kind of on suicide watch because they think no one can help them. Like, that's the kind of people that come in here, and it's like, I'm not going to turn them away. I don't turn anybody, but I'm very honest with them up front. And I say, look, if you and I work as a team, and if we're dedicated, we can do this together. Okay, you have access to me, right? I'm not going to answer my phone at all hours, but look, I do have lots of patients that text me, lots of patients that call me, and guess what? I dedicate a lot of my life to caring for these people, and so it does take a big heart. It does take a lot of you, if you're going to deal with these kinds of people. But I think when you understand the real problem, which is the world that we live in, is kind of, and yes, they have their own responsibility. Don't get me wrong, but I'm just simply saying there's nowhere else for them to go, is what I'm really trying to say. There's very few other doctors. There's guys like you, of course, but, lots of times, like I said, they're at their financial end, they're at their wits' end, and it's like, I try to put myself there for them. I go, look, I'm here to help you. You can reach out to me. I'll encourage you when you need it, but you got to play ball with me too. You got to do your part, which is show up. You got to put the money down for the supplements. You got to take them. But the good news is, if you do the program, we win. We're going to win. You're not going to be the 1 out of 10,000 that doesn't win on this program. You're going to play the odds, and you're going to win on this program if you put your work in. So I try to be as encouraging as I can while still being realistic with them.
Right.
I make myself available as much as I can for future visits, questions, that kind of stuff. And I think if you ask my patients, I do get calls on Saturday. I do get calls on Sunday, almost every weekend. And, again, not that I let it dictate my life, but the best answer I have to that question, Brad, is I'm as realistic as I can with them, but I'm also as encouraging as I can be with them. And I do make myself accessible. And I think that's the difference, as opposed to saying, good, buy a big package from me. And, in 6 months, my associates will look at you, and then I'll meet with you in 6 months for another package.
Right.
Which is, I think everybody does that, but there is kind of that thing. You do bump into that from time to time.
Right. I think it does take an interesting heart of service in order to cultivate a functional medicine practice, because it's so relationship driven.
Yeah.
It's so relationship driven, and I call it heart forward, right? Where if I'm leading with my heart, you better not mess me up, because I'm doing it for your best interest.
Right.
And it takes a lot, it takes a lot. So I had a physician, medical doctor, that was a retired surgeon, turned into a functional medicine provider. And I was talking with them one day, and they said they're at the end of their career, and they were like, you know what? I look back at what I've done and the sacrifices I've made for my family, and and for the families of the people that I serve. And I just think about all of the Saturdays I went to work, all of the Sundays I went to work, all of the times I answered the phone instead of, playing video games with my kid or whatever. And they had this idea where they were able to put words to the heart of service that it actually is to help people with lifestyle. It's different than just doing office visits. Lifestyle is ongoing. It's not for 15 minutes, right? And I think that's important. So good on you for doing that, doctor.
Oh, right back at you, Brad. I know you do the same thing. I know how important you are to your patients. So no, it's right back at you.
So let's do this. As we wrap up here today, Doc, and again, thank you for your time on the podcast. I want to give you an opportunity to speak really to the heart of your community, right? And I know, especially in Florida regions right now, lots of biotoxin illness, lots of Lyme, lots of diabetes, chronic disease, and where do you see this moving forward specifically for your community as it stands right now?
Where do I see what moving forward, Brad?
Functional medicine, healthcare, this movement that's really begun.
Sure. All I can tell you is I hope it keeps expanding. And I know that, here's what I can say. And this is another thing, I'm glad you said this, Brad, because another thing I say is like, we're going to be here. I'm not going to close this practice. You're always going to have access to this kind of thing through me and through my practice. So while I can't speak for the whole community, I can say I hope that it absolutely continues to flourish. And not that look, there's so many patients that I'm not even worried in the least about competition. It's the opposite. We need more doctors to spring up and to open their functional medicine practices right here in Clearwater, Florida, where I practice. So, and already there's a handful, but I'm telling you, we need more. So I sincerely hope that happens. But what I can say for sure, what I know will happen, and why I've built my practice the way I have, Brad, and we're an integrated practice now. And as I told you, in my 4 or 5 years of medical school, soon to graduate, because 90% or 95% or something like that of the raw public go to a medical practice, right? And yes, of course, I want to offer intravenous strips. I want to offer intravenous ozone, regenerative medicine, all this stuff that you can get here at our practice. But what I can tell you is I've built and I'm going to continue to grow this holistic / medical healthcare center. It's called New Era Medical. That's my practice, New Era Medical. So, if everybody else goes out of business, if everybody else stops, I can't speak to the rest of the world. What I do know is I'll make sure this place is here. So, if it is, your mother that's having the problem, if it's your spouse, God forbid if it's your child, I felt obligated, and I don't want to get too over the top here, but I really did feel obligated. It's like, what was the old saying from the one cartoon or something, with great power comes great responsibility, but it's so true, because once you realize what you can really do with these tools, and you realize that there's too few practitioners out there, and people are not just suffering, they're dying. How many cancer cases, even if they quote unquote are cured by the hospital, look in 5 years, how many of them have the cancer come back? And guess what? It's still the second time, right? Because again, we got to the root of it. So that being said, I can always make sure, I'll promise you this practice will be here. This practice is going to grow, and it's going to be here, for you and your loved ones, regardless of what the rest of the world does. I don't care how crazy it goes. I'm not going to let this practice fail. It'll be here for everybody.
Love it. I love it, Doctor. So thank you for spending time with the Nutrition Hero podcast today, and thank you for doing what you do. We appreciate it. I love talking with providers that are laying it down day in and day out for their patients and actually making a difference, not just keeping the lights on. So this is awesome. Good job, man.
Hey, thank you so very much. And Brad, I respect you a tremendous amount too. So thank you for having me on. It's really been a pleasure, and I look forward to next time.